All right, let's get rolling. Hello, everyone, and welcome to our webinar on emerging issues in child nutrition reauthorization, brought to you by CFARE, the Council on Food, Agricultural, and Resource Economics. Next slide. It's CFARE's mission to translate high-level research and knowledge to a diverse audience that includes policymakers, elected officials, and federal administrators. When we demonstrate the value of our profession, agriculture and applied economics, to these groups, the Council increases public appreciation for research, extension, outreach, and academic programs in agricultural and applied economics, and improves the quality of decision-making in these areas. Next slide, please. My name is Sean Cash, and I'm a CFARE board member and the Bergstrom Foundation professor at the Friedman School of Nutrition Science and Policy at Tufts University. I serve as the CFARE program chair, and it's my honor to be moderating our session today. Next slide, please. I'm just going to say a few words about today's topic, as our panel will be providing additional context. Every 5 years, Child Nutrition Reauthorization provides Congress with an opportunity to revisit and update the child nutrition and school meal programs that it authorizes. Programs such as summer and after-school meals, school breakfast and lunch, and the Special Supplemental Nutrition Program for Women, Infants, and Children, commonly known as WIC, fall under this umbrella. And their implementation has changed greatly in the last 2 years in response to COVID-19, as well as technological changes and changing trends in areas as diverse as school food procurement and the spread of telehealth. Next slide, please. As Congress picks up the gauntlet of reauthorization again this year, CFARE has assembled a panel of 3 experts to discuss their work and insights on priority issues around these programs that impact the lives of millions of children and families across the country. Travis Smith is an associate professor in the Department of Agriculture and Applied Economics at the University of Georgia. His research focuses on the economics of food policy, health, and nutrition in the United States. He has published articles related to food assistance programs, food insecurity, food waste, and related nutritional outcomes. Next slide, please. Our second speaker, Becca Jablonski, is an associate professor and food systems extension economist in the Department of Agricultural and Resource Economics at Colorado State University. Her research and extension program is comprised of 2 primary components. One is evaluating the farm and ranch profitability impacts of sales through non-commodity markets, and the other is assessing the community economic impacts of food systems policies, investments, and programs. Next slide, please. Our third speaker is Will Davis, and he's an assistant professor in the Department of Agricultural Economics at Mississippi State University. Will is a health economist with extensive experience evaluating the effects of government policies like the community eligibility provision on the health outcomes of individuals and communities that he'll be discussing today. Next slide, please. Before we start, I wanted to explain how to ask questions during the webinar to make sure that all of you in the audience know how to engage with us. During the webinar, you can put questions to one or all of the speakers by typing in the box in the control display, accessed by clicking on the question dropdown as shown on the slide and sending it to the organizer. Next slide, please. Now I'm going to hand things over to our speakers. First to Travis Smith, who will start us off.
Thank you, Sean. So today I'm going to talk about the Food Assistance Program Women, Infants, and Children, or WIC, and I'm going to focus on the child participants who lose access to their WIC food packages in the month following their 5th birthday. The goal is to answer the question, what happens to the quality of children's diet when they lose WIC at age 5? And I'm going to make a special note of the role of entering kindergarten, which could happen around the time a child turns 5, that is if they're born during the summer months and they age out of WIC and then go into school, or if these children are born in the winter or spring time, they would lose WIC at that time and then have to wait many months before they enter kindergarten. So next slide, please. So before I begin, I wanted to put into perspective all of the programs considered by Child Nutrition Reauthorization with regards to agricultural appropriations that will be discussed today. So Child Nutrition Reauthorization is unique that it doesn't fall under the Farm Bill per se, like SNAP, which you can see is the largest piece of the pie of USDA's program spending at $114 billion. The National School Lunch Program is highlighted in green, as you see here, and the School Breakfast Program, as highlighted in red, are the largest child nutrition reauthorization programs, nearing about $18 billion in annual spending. The remaining mandatory programs highlighted in blue include the summer food service, the special milk, and child and adult care food programs. So today my focus will be on the Women, Infants, and Children Program, or WIC, as highlighted in pink up in the top right-hand corner, which is a discretionary spending program. So as Sean mentioned, historically, Congress has reauthorized these child nutrition programs every 5 years, at which time the program parameters are subject to revision. But there hasn't been any reauthorization since the passage of the 2010 Healthy, Hungry, Free Kids Act some 11 years ago. However, in 2016, separate House and Senate bills went to their committees, but neither of them made it to their full chambers for vote. Next slide, please. So WIC served 7.8 million individuals in fiscal year 2018. Women and infants, who make up nearly 1/4 of participants, as you can see in the two left bars there, are the subject of a large literature on maternal and birth outcomes. Today, I'm going to focus on the children, who make up about half of the participants. In particular, I'm going to focus on the 4-year-olds, as highlighted by the green arrow, who lose WIC in the month following their 5th birthday. There are about just over 500,000 such 4-year-olds that we are discussing today. Next slide, please. So food packages, as displayed over to the right for 2 to 4-year-olds, in conjunction with nutritional services for the guardian, which are listed in the table there, such as nutrition education, preventative and coordination services, promotion of breastfeeding and immunization. These are the main tools by which WIC can affect child nutrition. All states now deliver food packages via electronic benefit transfer, or EBT. So the parents or the guardians use their WIC EBT cards to redeem eligible foods that you can see on the right there, such as low-fat milk, yogurt, cereals and whole grains, fruits and vegetables, juice, cheese, eggs, and beans or peanut butter. These are the food items that children lose when they turn 5 years old. In terms of program costs, as you see in the table, spending on food packages has declined substantially over the past decade, from about $5 billion in fiscal year 2011 to just under $3 billion in fiscal year 2020. The nutrition services and administration spending has remained relatively flat at $2 billion. I'm going to return to these figures at the end of the presentation when I discuss the policy implications of this research. Next slide, please. So I want to tackle the question of how does school enrollment factor into this. So children typically start school when they are around 5 years old, but not exactly when they turn 5 years old, like when they lose WIC. So most states use a cutoff around August, September. So half the states actually use August 31st or September 1st, but a vast majority of states, actually 42 of them, use a threshold somewhere between July 31st and October 15th. So we know from previous research by myself and others that school meals are the highest quality food consumed by low-income children, especially those that are prone to lower quality at-home diets. Moreover, simply attending public school can free up childcare costs that could be diverted to other investments in children. So you may ask, why does this matter for WIC? So Dave Frisbald and his colleagues have found that these WIC habits are short-lived after children age out of WIC and last about 6 months at most. And I'd like you to consider 2 types of children that we'll be looking at in this research. First is a child that's born in summer or early fall or perhaps late spring. This child would lose WIC during this time, but then would start school shortly thereafter, perhaps going on to the school meal programs. Then I'd like you to think about a different child that's born in the winter or spring months. So this child would lose WIC and must wait about 6 months or so to start school. So what we did in this research is we analyzed food consumption for these 2 types of children, and we looked at the quality of their diets as they aged out of WIC. Next slide, please. So let me just take a minute to explain how to interpret these results. So we were interested in more than just the average effects, that is for the average low-income child that ages out of WIC. And we wanted to know how children that are prone to lower quality diets fared against children that are prone to higher quality diets. This could be due to parental characteristics or even environmental factors. So what you're looking at is on the horizontal axis of each of these figures ranks children by the quality of their at-home diets. With the lowest quality diet on the left-hand side, you can see their rank from 0 to 100 there, and the highest quality diets on the right, up towards the 100. The vertical axis is the aging out of WIC effect. This is the percentage decrease in diet quality that we estimated when a child loses WIC, and this is shown by the solid black line that moves from low quality diets to high quality diets across the figure. The shaded gray regions that you see there are the statistical confidence bands. So if they overlap 0, then we can infer there's no effect. So we compare children who lose WIC in school, that's the top 3 panels that you see there, versus those that lose WIC when they're out of school, and that's the bottom 3 panels. And we're going to look at depending on when they were born across these different columns. So for example, in the very left column you see there, we considered all birth months, and we find no effect at all of aging out of WIC on diet quality. In the middle panel there, we considered the summer or fall births. Here again, we find no effect. And one reason for this result is the way that the question was asked in the data, and this is important. And they asked parents, they said, during the school year, does your child attend kindergarten? So that middle column that you see there, these are parents that are being asked during the summer if their 5-year-old attends school during the school year, and they may be saying yes, although their child is not actually in school. And in our paper, we show strong evidence that this is occurring. So finally, in the right column, these are the children that are born in the winter or spring months. Sometimes these are referred to as late school starters because by the time they start school the next year, they're well into their 5.5 years old or older. Here we find for those that are these late school starters that are born later in the winter or spring, as you can see in the bottom right panel with the circle, that there's a 25% decline in dietary quality. And all of this is concentrated for those that are prone to lower quality diets at home. So these are the most vulnerable low-income children. And we can see up until about the median that there's about a 15 to 20% decline in dietary quality. So although not listed here, this research does complement previous findings that show that parents are more likely to report food insecurity after their kid ages out of WIC, as well as being more likely to seek out alternative or private food assistance for their children. And finally, I'd like to also say that we investigated calorie consumption and we found no change. This implies that children are swapping their healthier WIC foods for less healthier foods after their kids age out of WIC. Next slide, please. So what is the policy implications here? So one question would be, what is the cost of letting kids stay on WIC until they enter kindergarten? So we know that the child food package costs roughly $32 a month for the 4-year-old group. And we also know that there's just over 500,000 4-year-olds. So if you assume uniform births, which is likely across all months across the year, the food package cost increase would be about $88.8 million, which is 1.7% of the $5 billion. And if you look in the figure in the top right, where you can see the cost of food packages has been declining, as I mentioned, the little blue bar in fiscal year 20 is the estimated increase to allow kids to stay on WIC. And in fact, there are 2 current companion bills that propose just this. It's called the Wise Investment in Children Act, or WIC Act of 2021, which gives states the option to allow the 4-year-olds to stay on WIC until they either enter kindergarten or turn age 6, whichever comes first. This was proposed in 2020 and has been proposed again in the 117th Congress. So next slide, please. So I'd be happy to take any questions at the end, as Sean mentioned, or you can contact me directly. You can see my email there, which is tasmith@uga.edu. Thank you.
Thank you, Travis, for your presentation. And I'd like to remind everyone in the audience that you can pose your questions at any time to our panelists, and we'll get to them after the initial presentations. Well, now we'll be hearing from Becca Jablonski. Go ahead, Becca.
Great, thanks so much, Sean. Let's see, so we can go to the next slide, please. Perfect. I just want to highlight that this research I'm going to present today from a few different articles is funded by the USDA's National Institute of Food and Agriculture, as well as the Foundation for Food and Ag Research, and involves a number of colleagues. Next slide, please. So the National School Lunch Program, as Travis mentioned, is really a key food and nutrition assistance program in the U.S. It feeds the majority of low-income, food insecure households with school-aged kids. And there's research that shows that for students that receive lunch at school, it makes up about 1/3 of their daily calories. And most of the studies that have been done on the National School Lunch Program really talk about how it's associated with significantly lower rates of food insecurity for households with kids, as well as improved dietary quality and academic performance. So really across the board, research has shown how important this program is. Next slide, please. In addition, research conducted by the USDA Economic Research Service has shown that schools are the only acquisition location where households that receive the Supplemental Nutrition Assistance Program had a higher nutrition score than non-SNAP receiving households. Next slide, please. So we know that the National School Lunch Program is really important. And when COVID hit, the schools closed and really had to make decisions almost overnight about how to respond. Really, literally, they had about a weekend. And so what the USDA Food and Nutrition Service did was to provide relaxation and waivers for many of the existing requirements in order to receive reimbursement. So on one hand, this is really important because we know that there's a lot of heterogeneity across the United States, right? There's no two places are the same. We have a lot of differences. And so it was really important to have that flexibility. On the other hand, there were no federal mandates that schools offer food service during closure or guidance on best practices. So as a result, every school district really responded differently with their own choices. And this was really difficult in some ways because schools are not necessarily experts in how to respond, right, in putting together these different types of food policy, especially in the face of an emergency like a pandemic. And so what this research set out to do was really to understand what cities were doing to support emergency food service provision to children and families in need. And did we see, at least qualitatively, that there were indicators associated with the effectiveness of these different types of local approaches? Next slide, please. So we had 5 teams of researchers that were really in good shape to be able to answer this question because we had all received funding from the Foundation for Food and Ag Research. And we received this funding in part because we already had very strong local networks within these cities. So we had both research teams that came together with municipalities and with the network of emergency food service providers. And so we could sort of respond quickly with this existing network to understand exactly what cities were doing and to try to understand some of the effectiveness. So if you go to the next slide, please, I'm going to highlight 2 of the things that we saw were associated with effective local programs. One was cross-sector collaboration, and 2 of our cities, Denver and Austin, really showed us that because there were these strong networks that had been in place prior to the pandemic, that there was already trust built across these organizations and across really, I think, broad networks of organizations in this space. And so what ended up happening in both of these cities was what they called needs and haves coordination. So you could have one entity that said, we really need this. We have a population that requires X. Can you provide it quickly? And we had other partners there who said, yes, we have it. We have this, or we have other things. And so they were able to really effectively figure out how to utilize some of those resources. It also supported strategic placement of additional emergency food service sites. And this was important because what we found, even in these cities that had strong cross-sector collaboration prior to the pandemic, was that when they made those initial decisions, when the schools closed, they realized that they didn't necessarily do everything right away. And so they were constantly reevaluating and figuring out where should they have these emergency feeding sites. And so thinking about how to work together to best communicate was really important. On the other hand, we saw that there were cities like Flint, Michigan, where there was really lack of coordination of efforts, even as the organizations worked towards similar goals. And so, for example, in Flint, prior to the pandemic, a lot of collaboration was happening through faith-based communities that would hold in-person events, and partially because a lot of the inhabitants in that city didn't necessarily have access to broadband or high-speed internet access. But when the in-person events closed, it really created some challenges. And then there were a lot of outside resources that were coming in to provide support in terms of emergency food service provision, but they weren't requiring that these different stakeholders work together. And so as a result, there was actually a lot of sort of competition and not necessarily effective use of or efficient use of resources. Next slide, please. So the other piece I wanted to highlight today was the importance of adaptable supply chains. Please click again. And so one of the things that we saw was that larger networks with more buying power appeared less likely to experience supply chain challenges. Can you click again, please, on the slide? So just as an example, Denver had about 106 food pantries prior to the pandemic. And as of July 2020, we saw that only 62 of those continued to be in operation. And we think that this was because when Feeding America recognized the additional demand for their services, right, and for the provision that they provided to food banks, that they figured out that they needed to be really efficient, that maybe they couldn't have their networks doing quite as many drops. And so what we saw in Denver was that actually, even with these closures, that these food banks were able to move more food. So that's great. They were able to be more efficient. However, these smaller pantries closed because they just couldn't get access to the supply chains necessary to ensure that they had food in these pantries. So the question here really is, we saw that there's more efficient, that there's certainly more food moving through the system. Were there stakeholders that were left out, right? Were there some that didn't have access to transportation and couldn't get to some of those perhaps more distant locations? But either way, that those larger networks appear to be really important to get access to those supply chains. Next slide, please. We also saw that, generally speaking, these emergency feeding programs rely on volunteer labor. The volunteer labor tends to be higher risk, right? They tend to be older adults, for example, and many have pre-existing health conditions. And so having the ability to develop cross-sector partnerships to fill gaps became really important. So for example, Cleveland noted that there were very few summer meal programs that operated just because they didn't have the workforce in place. So that adaptable supply chain component seemed to be really important. And we already see that USDA is doing some work to really try to understand resilience in supply chains. Next slide, please. So overall, we have a few policy implications from this research. So one is that, of course, we see that it's important that there was a decentralized approach because of that heterogeneity across places in the United States. However, maybe that with the waivers and flexibility coupled with more direct guidance from the federal government on best practices would have been helpful. And so thinking about what that guidance might look like moving forward is something we should certainly be considering. Next is that although waivers are needed, there are likely trade-offs, for example, with dietary quality, right? So it's important that everybody gets access to meals. That's critical. We don't want anyone to starve, of course. However, thinking about how we do that while not sacrificing dietary quality is also important, particularly as we see that these waivers are continuing and there's discussion around universal meals. And so thinking about what that balance might be is really important. Finding opportunities to support funding even in non-emergency situations is going to be really important, right, to make sure that we have those collaborations in place. And then, of course, the importance of a systems perspective, and that's really how we can get at more of those resilient and adaptable supply chains. Next slide, please. So finally, with my minute or two remaining here, I just wanted to mention about the Farm to School program, because as part of the Child Nutrition Reauthorization Act of 2010, that was the first time that there were designated grant funds to support Farm to School. You can see from the numbers here that the funding is still not huge. It's going to Farm to School, but it has been growing over time with about $12 million provided in both 2020 and 2021. I also just wanted to mention that sometimes people think of Farm to School programs just around procurement, right? The school district purchases from local farmers and ranchers. It also includes things like agricultural education, nutrition education, as well as school gardens. Next slide, please. So with some colleagues at Colorado State University, as well as the University of Illinois, we actually completed a systematic literature review. So we reviewed all of the research that was out there that looked at the relationship between farm to school activities, farm to school related activities, and student outcomes. And we found three main findings. One is that there's consistent evidence that farm to school programming is associated with increased nutrition related knowledge. The second is that most studies find that there's a positive relationship with healthy food selection, nutrition self-efficacy, and willingness to try fruits and vegetables. However, more of the sort of long-term impacts on fruit and vegetable consumption and preferences are inconclusive, right? And so we really want to understand what some of those long-term implications are, particularly if we're going to see that this is an area that is going to continue to grow in funding that is available. So with that, I just wanted to highlight my contact information as well on the next slide. And so please feel free to reach out to me with any questions if you don't get to ask the question today. And finally, if you go to the next slide, I did want to also point out that we have fact sheets that are available about the farm to school specific research on our website, and I can make sure that we put a link to the chat, a link in the chat to these fact sheets. Thank you, Sean.
Thank you so much, Becca. And we'll also be preparing a summary of today's webinar that'll include links to any of the materials that the presenters are willing to share. I'd like to remind everyone in the audience to please pose your questions at any time. You can share them in the side panel, and we will get to those after our third presentation, which Will Davis is about to start with now. Go ahead, Will.
Hello everyone, my name is Will Davis, and today I'll be presenting some of my research looking at the effect of the community eligibility provision on child weight. So the community eligibility provision has been a pretty big change starting with the last Reauthorization Act. And today we're going to talk about some of my research looking at how it impacts child BMI percentile and the probabilities of falling into different weight classes. So for a little background on what the community eligibility provision is, like I mentioned, it was introduced as part of the 2010 Healthy Hunger-Free Kids Act, so the last Reauthorization Act. And the community eligibility provision really represents a pretty big sea change in how school meals, or specifically free school meals, are provided to students attending low-income schools. So specifically, the CEP allows schools serving high percentages of low-income students to offer universal free lunch and breakfast to all of their students. So as opposed to the traditional program where an individual student would have to qualify for free or reduced price meals based off their income or other characteristics, instead, if they attend a CEP school, they can just get free lunch and free breakfast guaranteed for the entire student body. So this has been a pretty large change that's occurred in the last few years. And another thing to note is that the CEP is a voluntary program that schools and districts who qualify for the program are allowed to actually participate in. So it's not mandatory for low-income schools, but in general, participation has been pretty high, and we'll see that in the next slide. So in this figure, what we see is the percentage of eligible schools. So these are schools that were eligible for the CEP in 2018 and 2019, and then the percentage of those schools that actually adopted the program by state. So you can see there's some variation across regions in how many schools actually sign up for the program, but in general, participation is pretty high, with on average about 50 to 74% of all eligible schools actually participating in the CEP. And at this point, it's estimated that a little over 8 million students currently attend a CEP school where they're able to receive universal free lunch and free breakfast. So this program has impacted the lives of quite a few students, and the question then becomes, how do these universal free school meals provided in low-income CEP schools actually affect child outcomes? Now, as far as how the CEP affects student outcomes, there's been some previous existing work that's found that the CEP has beneficial effects on student academic performance, student disciplinary outcomes, the likelihood of food insecurity, and hunger. So while some existing studies have found that the CEP does have these beneficial effects on these outcomes, slightly less is known about the CEP's impact on student weight. So specifically, if we think about offering universal free school meals, that's likely going to change the dietary quality, or at least the caloric intake, of quite a few students. But we don't know quite as much about how the CEP impacts child weight as we do about some of these other outcomes. And that's what we're going to be talking about today. So when we think about the potential effect of the CEP on child weight, it's important to contextualize the actual effects that we expect to see and then think about the mechanisms of actions, what's driving the effects. So the CEP's effect on child weight is likely going to depend on the child's alternative meal options, so what they would be eating instead of a free meal provided under the CEP, the actual quality of the school meals themselves, which is going to vary across schools, districts, states, and regions, and then some individual child characteristics that could potentially determine the effect. But in general, I expect the majority of the weight effects that I find in my papers to be driven by three groups. The first are children who were not free reduced price meal eligible prior to the CEP. So these are students who did not qualify for free reduced price meals, but then once the CEP is introduced, suddenly all students get access to free reduced price meals. So that could change a child's diet. The second are children who were FRP eligible, but they did not choose to enroll in the program, either due to difficulties with the application process or personal or household characteristics. So these students could have signed up, but they chose not to. And then when the CEP is introduced, suddenly they're put into a school where everyone has access to free meals. And then the third group is sort of a general group of children who brought meals from home. So these are students who, before the CEP, were bringing meals from home. And then after the CEP, when school meals are now free for everyone, it's possible that these children may switch to school meals, or it's possible that they may even double dip, where they continue to bring meals from home and then also consume free school meals, which is an issue brought up by some child nutrition directors I've spoken to in the past. Now that we have kind of a general idea of what the CEP is, and as well as some of the theoretical ways it may affect child weight, I'll start talking about some of my research. So specifically, what I'm going to be talking about today are results from 2 working papers that both use child-level longitudinal data to examine the effect of CEP on child weight. So these are preliminary results, so make sure that you have that in mind. But the data that I use include, the first one comes from a nationally represented restricted use survey data set. So this is data of children who all started kindergarten in a specific year and then continued until the 5th grade. And I could observe when they started attending a CEP school, if they did, and use the longitudinal nature of the data to try to control for some individual heterogeneity in our actual specifications. And then the second data set is from a large school district in the Atlanta metro area, and it's administrative data on children that allows me to see them as they attend the district throughout time. And it's important to note that in both of these data sets, child height and weight is objectively measured. It's not self-reported. So I'm able to absorb some of the potential heterogeneity and misreporting in child height and weight that we may see in other data sets where they're not objectively measured. And specifically what I do is I estimate the CEP's effect on child BMI percentile, and then the probability of a child being underweight, healthy weight, overweight, and obese. So what do I find in my papers? Well, what I find is that in both studies, I find that the CEP is linked to significant increases in child weight. Specifically, I find that the CEP leads to higher BMI percentile among students, as well as decreasing the likelihood of a student being healthy weight, increasing their likelihood of being overweight, and increasing their likelihood of obesity. So in general, the CEP is found to increase child weight outcomes, and I also find some evidence that the effect is a bit larger for girls than boys, as well as being slightly larger for younger children. And then I do find some regional variation in the effect across different regions of the United States, and there is a little bit of evidence of a potentially beneficial effect in the Northeast. So in general, the CEP leads to what we would consider to be worse child weight outcomes than students who were attending non-CEP schools during the same period. So what are some of the policy implications of my research? Well, the first big one is that I find the CEP's effect on child weight actually runs counter to the policy's intended goal. So one of the policy's goals was to improve child weight outcomes by offering universal access to high-quality free school meals. But instead, I find that introducing universal free school meals into low-income schools in CEP actually leads to detrimental effects on child weight, which is the opposite of what the policy was intended to do in that regard. But one thing to point out is that it's important to couch the effects on weight that I observe in my studies with some of these beneficial effects on, say, child-student academic achievement, and then on disciplinary outcomes that have been found in other studies. So while I do find some detrimental impact of the program on weight, it's important to note that the CEP has been shown to have a beneficial effect on these other student outcomes, and we need to combine our understanding of these various outcomes into one general understanding of how the policy affects students. Now, finally, it's important to point out that future research is going to be needed to identify some of the mechanisms through which the program impacts student weight, and this is going to be important if we want to design future universal free school meal policy. So Bernie Sanders sponsored a bill with some of his colleagues looking at how can we offer just universal free school meals in all schools across the United States, and my study finds that that may lead to some detrimental impacts on child weight. So if we can figure out some of these mechanisms, hopefully we can design future policy that's able to get the beneficial impacts on student academic achievement, discipline, food insecurity, and hunger, while not having the associated impact on weight that I observed in my studies. Finally, if you have any questions, please send me an email at my email address listed on the screen. I'd be happy to answer any questions you may have. Thank you for taking your time to listen to the presentation.
And before we wrap up, we'd like to encourage those of you who enjoyed this webinar to sign up for our newsletter, where you'll get more information on similar events online at cfair.org. A recording of this webinar, as I mentioned, will be made available on our website and YouTube in the coming days. We also have a podcast series, Get a Grip on FAIR, available on our website, Spotify, and Apple Podcasts. You can find it by searching for our name. That's the Council on Food, Agriculture, and Resource Economics on any of these platforms. I'd also really like to thank our oh, sorry, I forgot to mention our Twitter feed as well. Please follow us on Twitter for regular updates at CFAIR Econ. And you can always send inquiries to us over email as well. Next slide, please. I'd also like to thank our partners and sponsors. This and other CFAIR programming wouldn't be possible without the continuing support of the Agriculture and Applied Economics Association, the U.S. Department of Agriculture's the National Agricultural Statistical Service, as well as the Department's Economic Research Service also provided support. Next slide, please. Finally, I'd like to give a big thank you to all of our panelists. I learned so much today during the session, as well as from being able to speak with all of you as we were preparing for today's session. And I'd like to also thank the audience. We're passionate about this subject, and we know that you are too, as it's not a small thing to give up an hour of your time to spend it with us. Also, from the quality of questions and comments we get, I know there are a lot of experts on this material in the audience as well, so we really appreciate your participation and attendance. We hope you enjoyed this event as much as we enjoyed hosting it. Thank you all so much, and have a great day.